You know, good health is more than just exercise and diet. It's lifestyle, it's education and it's research. And no organisation achieves more in that area than Australian Rotary Health. They have now given over $20 million to help improve the health of all Australians, the young, the elderly and the needy, and they intend to give a whole lot more. This is the chairman of Australian Rotary Health, Noel Trevaskis, to tell you more about their plans.
Thank you, Michael. During the next year, Australian Rotary Health will continue its support of health research, awareness and scholarship programs, as well as continuing to fund PhD scholarships in other areas under our funding partner program, which requires contributing funds from a Rotary Club or a Rotarian. We also offer postdoctoral fellowships for research into mental health illnesses we currently know little about.
The Royce Abbey Fellowship has supported my research into the changes in brain chemistry that are associated with schizophrenia, a devastating psychiatric disorder which affects just under 1% of the population worldwide. Schizophrenia tends to develop in early adulthood, between the ages of 18 and 24 for males and a bit older for females. It is a chronic disorder which generally affects these people for the rest of their lives, impacting on their ability to provide for and look after themselves. By understanding the changes in brain chemistry that occur as a result of the disorder, we hope to be able to develop better treatments for people with schizophrenia, enabling them to regain some independence and control over their lives.
Our main focus remains mental illness, which affects 1 in 5 Australians. Unfortunately, it is believed that percentage will get worse before it gets better. For this reason, we will continue to fund 20 mental health grants a year, with each grant worth up to $70,000 per year. As part of our mental health awareness program, we will support a new program for Rotary clubs, Mental Health First Aid, which helps family and friends cope when faced with a mental health issue.
Too many young Australians are suffering from mental illnesses that greatly disrupt their lives and can increase their risk of suicide. I'm delighted that Australian Rotary Health is giving their support to a program that helps the community to give assistance and support to people with a mental health issue. The program is called Mental Health First Aid, and it teaches us how to respond when someone you live or work with is developing a mental illness or experiencing a mental health crisis like suicidal thoughts. It's extremely important that people living with someone displaying possible mental health symptoms are able to recognise those symptoms at an early stage and assist the person to get professional help. How do you tell the difference between someone who is moody and someone who is suffering from depression? How do you behave towards them? And who do you call on for professional assistance? Mental Health First Aid helps answer these questions in a simple, straightforward way. Remember, mental illness is like any illness. It can be treated, but the earlier it's recognised and treatment begins, the better the chance of early recovery.
Australian Rotary Health is committed to improving the health of all Australians, and that includes the original inhabitants of this land.
Australian Rotary Health is continuing to help improve the health of Indigenous people through the funding of scholarships for Indigenous people wishing to train as doctors, nurses, psychologists, and so on. This initiative will have a real impact on the general health of all Indigenous people, as well as providing a great opportunity for young people to pursue a career in health and well-being.
We also have rural nursing scholarships that allow trainee nurses to do their final year of nursing in country hospitals and clinics to give them a more practical experience in their chosen vocation. And rural medical scholarships to enable trainee doctors to complete their final year of training in a rural environment.
Skin cancer is one good reason to wear a hat, and now we have another good reason. Australian Rotary Health Hat Day on Friday the 20th of May will increase mental health awareness and raise funds for mental health research. So don't keep mental health under your hat.
That does not cover all of Australian Rotary Health's broad range of activities, but it does give an indication of how we care for the health of all Australians.
Australian Rotary Health is one of Australia's largest providers of fund for health research. And thanks to the generous assistance of Rotarians throughout Australia, we are now a very efficient business. Each and every donation will make a difference to the future health of all Australians. Australian Rotary Health. Good health, Australia.